Hello, and welcome to the Ear Clinic. My name is Dr. Witcher, and I'll be taking care of you today. Please have a seat, make yourself nice and comfortable, and while you are making yourself comfortable, I'm going to get some questions ready. All right. Can I get your name before we start? It's a very beautiful name. Okay. So, why are we here today? What can I do for you? Okay, I see. So, when was the last time that you had an ear infection? Do you remember for how long it lasted? Okay, that's quite a long time. And how did you treat it? Okay, very good. Did that work fine for you? Growing up, did you have many ear infections? Oh, really? That's definitely a lot. Okay, we're going to have to really check your ears and see what may be the cause of the ear infections. How would you describe your hearing right now? How do you hear me? You hear me nice and clear, sharp? Would you say that your hearing is the same in both ears? Okay, good. Just a few more questions. How do you clean your ears? That's a good way of cleaning them. Have you ever gotten them professionally cleaned before? And when was this? How did you feel after? I bet. I love getting my ears cleaned. And one more question, I think. Actually, no. That's all the questions that we have for now. So, to make sure everything is okay, I would recommend doing an ear check, ear cleaning, physical exam, so that is where I touch your ears, a blind test, so that includes me covering your eyes and making some sounds around you, behind you, etc., and also a beep test. Would you like to proceed with all of these tests today, or would you like to do them maybe in different days, like section them out? Today. Great. Amazing. So let's start with the ear check. The first step is always putting on gloves. If you ever go to get your ears cleaned and they don't put gloves on, run. It's very important. Do you feel comfortable? Good. And a little bit of hand sanitizer. The first thing that we're going to do is have a look inside with an otoscope. This will show me if there's any infection, any inflammation, any redness, any irritation, etc. And all you have to do is keep your head nice and straight, just like that, and try not to move it. If you need to move, please let me know. but try to avoid sudden movements like that. I don't want to hurt you. Okay? Let's begin. And let's start off with your left ear over here. All right. Are you sure you don't feel any pain? Okay. Because your ear canal is a little bit red and it is also quite inflamed. It's actually inflamed quite a lot. Okay. I want to see if the other ear looks the same. It actually does. It looks very similar. I'm really happy that you don't feel any pain, because normally when I see patients with their ear canal as inflamed as yours, it can be quite painful. I'm going to be adding in some drops, and this will help out with the swellness and the redness as well. Going to let that sit for a little bit, and then do the same in the other ear. This pretty much does the same thing as the drops, but it's a little bit stronger. And for your ears, I think both of them together combined would do you a lot of help. How is that? Okay, and a little bit more. I'm going to be pulling out some of the excess wax that you have inside now. So if you feel any discomfort, please let me know. How does that feel? Okay, good. You don't have a lot of wax though, just a little bit. And I can see it's coming out very easy. Perfect. And let's do the other ear. In this ear, you have a little bit more, but it's still very little. It's not a lot. Just a little bit more. Okay. How do you feel? Good. So, what I'm going to be using now is a special tool, machine actually, that goes inside and swirls. So it cleans out your ear very, very good. And it is a little bit louder, but it is very comfortable and sometimes it's quite tingly. But if you want me to stop, just let me know. And keep your head nice and straight for me, like the beginning, and don't move. Okay? It's very important. How's that? Personally, this is my favorite tool, so I hope you enjoy it as well. Okay, fantastic. That really did do the job. Now, I think that we can go on to the next stage of the tests, which is the physical exam. And before we do that, I'm actually going to put a little bit of cotton inside your ears, just for a bit of protection. Okay? And we're going to place that inside. Nice and comfortable. Good. Okay, so we completed the ear check, the ear cleaning. And next we have the physical test. For the physical test, I will be removing my gloves if that's okay with you, just because sometimes when I use my gloves for this, it can alter the sounds that I'm actually trying to make, so the sounds I'm trying to imitate. Okay, thank you. It is quite important that the sounds are very accurate when conducting this test. I'm going to put some hand sanitizer on, so don't worry. So, what can you hear? Good. Can you feel this? Good. And you hear it in both, right? Same volume? Mm-hmm. What about this? Can you hear this? Good. I'm going to open and close your ears So you will feel kind of like a suction type of sensation, just so you know. Can you hear that as I described it? Good. Is it comfortable? Tell me when I change the rhythm. Pay attention to what you hear. Good. And again. Tell me when it changes. Brilliant. Now I'm going to close your eyes and make some sounds. And of course, I'm going to ask you some questions based on what you hear. So, eyes closed. Is this your left ear? Okay, good. How about this? Is this your left ear? Is this your right ear? What do you hear? Try to describe it as best as you can. Excellent. What am I doing to your ears? Am I tapping on them? Or am I opening and closing them? Am I tapping or opening and closing them? And what about now? What am I doing to your ears? Am I touching one ear or both at the same time? Tell me, in which ear do you hear me in? Is this your left or your right ear? And what about now? Left or right? I want you to repeat back the words that you hear me say in each ear. First word is lollipop, lollipop, lollipop. Popsicle, popsicle. Confetti, confetti. Very good. Dalmatian, Labrador, Labrador. And my favorite, coconut, 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 coconut. Which ear am I in? Coconut, left or right? Excellent. Now I'm going to go behind you and make some sounds. Your job is to tell me from which side, which direction the sounds are coming from. And also try to describe them as best as you can. Let's begin. Where do you hear the sound coming from? Is it in the same place or is it moving? Pay close attention to what you hear and from where you hear it. Perfect. You did so good. Seriously. Now we only have one more step to do, and that is the beep test. I will explain it to you just before we start, but first I need to put some headphones on you, just like mine. And let me know if they are nice and comfortable. Yeah? Do they feel secure? Good. So, you'll hear some beeps and sounds, and I will ask you questions based on what you hear. So, the first phase is where you hear beeps in both ears at the same time. I want you to raise your hand or nod your head when you hear those beeps come true. Okay? Are you ready to start? Starting in 5, 4, 3, 2, and 1. Excellent. Nice and easy, right? Good. Now you will hear those beeps in your left ear only. I want you to do the exact same thing. Raise your hand when you hear those come true. Starting in 5, 4, 3, 2, 1. Great. Now let's do the opposite ear, your right ear. In 5, 4, 3, 2, 1. Fantastic. Our next stage is the frequency one. So you will hear a frequency, and I want you to tell me when it stops. Starting in 5, 4, 3, 2, 1. Good. Do you think you're able to do one more? Okay, but it is a little bit stronger, a little bit louder. As you noticed, it got louder and louder. Is that okay? Think you can handle it? Okay, let's start. Perfect. How was that? Was it a little bit too loud? Too much? No? Good. I'm happy to hear that. You can actually take your headphones off, and there's a table behind you, a small one. Just place them there. You're very welcome. You actually did really good in this beep test. So, the only thing that I'm going to give you are some drops that I want you to use daily for 7 days. Okay, and you're going to be using them for 3 times a day. I'm going to write that down for you and hand you the prescription. Can I get your signature over here, please? Excellent. And that's your prescription, okay? So, thank you for coming in. I hope you enjoyed this procedure. Everything went super duper well. Only thing that I'm worrying about is your ears, but these eardrops will definitely do the trick. Thank you again, and goodbye.